Right. We know that the MET pathway is an important pathway in various cancers, including non-small cell lung cancer. There are diverse ways whereby the pathway can get activated, including MET exon 14 skipping mutations, MET amplification, MET overexpression. There is a rare entity in terms of MET alterations, which is called MET fusions, and MET fusions are rarer than other MET alterations. However, it is now recognized that it is potentially a targetable genomic alteration based on some of the case reports and case series in the literature. And so there were recent studies out there that show that the prevalence of MET fusions in non-small cell lung cancer was about 0.2 to 0.3%. And so based on this background, we wanted to gain deeper insights into MET fusion positive cancers, including non-small cell lung cancer. So in order to do that, we reviewed the pan-cancer carriers database, and the samples underwent comprehensive analysis, including whole exome and whole transcriptome sequencing. MET fusions were seen in various cancers, including non-small cell lung cancer. Interestingly, the highest prevalence was seen in high-grade glioma, so CNS cancer. In lung cancer, it was about 0.1% of non-small cell lung cancers. And one of the interesting features was that we see MET fusions almost exclusively in lung adenocarcinomas, not much in other histologies. It is a little more common in females. And then we detected the various fusion partners in about 10 unique partners. And so that was one of the main findings. And we looked at the alterations or co-occurring mutations, and TP53 was the most commonly altered gene. And then what was notable was that there were some cases where we saw potential other driver alterations, such as EGFR, KRAS, BRAF, and RET fusion, and MET amplification, and MET exon 14 skipping mutations. However, there were cases where we didn't see any other potential driver alterations, and we thought that in those cases, MET fusions might be the driver event for the cancer. And so it is our understanding that there are potentially two types of MET fusions: one, primary driver, or secondary MET fusions as a acquired resistance mechanism. And importantly, clinically, when we look at the survival of these patients, those with the MET fusion positive lung cancer had quite poor overall survival. And the median overall survival was only 7.8 months, which was significantly inferior to the 16 months or so with the non-MET fusion positive non-small cell lung cancer. So we conclude that in order to effectively target MET fusion positive cancers, including non-small cell lung cancer, there should be more research in this area.